All right, to roll out our adductors, which are our inner thigh muscles, we're going to use either a foam roller or we may need to use a medium-sized ball. But what we're going to do as a quick rundown is we're going to lay directly on our side right next to that roller, and you're going to set the roller up so it's right next to your thigh. Hike that top leg right on top of that roller, and then all you're going to do is try to rotate the rest of your body away from that leg. And what you'll feel when you do that is that the pressure from the roller really starts to push into those inner thigh muscles. When you feel that, it's very tempting to want to brace against it, but you really want to try and maintain your calm breathing. So it's best when you feel that tension increase to take a big deep breath in, hold the top of that breath for a couple of seconds, and then take a nice deep exhale, trying to blow out for as long as you possibly can. If you can maintain that breathing pattern, your body will start to accept the tension that you're feeling in this muscle, and it will allow you to get used to it a little bit better. As I get used to this tension, what I can start to explore with is starting to move my foot back and forth. So I can try to straighten my leg out as much as I can, and I can also try to pull my foot back towards my hips as close as I can get it. I do want to try and maintain tension on the same spot on these adductors. A big mistake that people make whenever they go to use a foam roller is they want to move the roller back and forth to, just as the name implies, roll out their muscles. But it's kind of a misnomer. We do want to try and keep that pressure in the same exact spot for as long as possible. So when you're going to do this mobilization, in the beginning, it's totally fine to try and search around a little bit to make sure that you're in the most sensitive area, or the area that feels like it's holding on to a lot of tension. Once you find that spot, it's best practice to try and keep the roller there, try to breathe into that tension and into that feeling, and then work on trying to move your foot back and forth to try and get this muscle to act a little bit more normal.